Hi everyone, this is Satya Rhodes Conway of the Mayor's Innovation Project. Thanks for joining this webinar on nudges for local government today. We will get started in just 1 minute. We still have a few people joining the call. While we're waiting, let me tell you that all of the attendees are in listen-only mode. That means that your microphones are muted. If you have a question, you can either chat it to me in the chat box, or you can raise your hand and I can unmute you so you can ask it. We're just going to wait maybe 1 more minute. There's still a few people joining. All right, let's go ahead and get started. Thanks again, everyone, for being here today. My name is Satya Rhodes Conway. I'm the Managing Director of the Mayor's Innovation Project. As I think all of you know, the Mayor's Innovation Project is a national learning network for mayors and senior staff. We're focused on the high road of equity, sustainability, and democracy. We're very excited today to be working with the Harvard Behavioral Insights Group to talk about nudges for local government and ways that Mayor's Innovation Project cities can craft and implement such nudges with the help of our friends in the Behavioral Insights Group at Harvard. So what I'm going to do is pass this along to the folks at Harvard, starting with Abby Dalton, who I will ask to introduce herself and share a little information about the program, and then we'll hear from Leslie John as well, and then we'll take questions and talk a little bit about how your cities might be able to engage in this work. Abby?
Yep, thanks, Satya. So I am Abby Dalton, Abigail Dalton from the Behavioral Insights Group. I'm the Assistant Director, and I manage this program under the direction of 2 faculty co-chairs, Max Bazerman, who's a faculty member at the Harvard Kennedy School and the Harvard Business School, and Iris Bonet, who was the former dean of the Harvard Kennedy School and now runs the Women in Public Policy program here at HKS. The Behavioral Insights Group also goes by BIG, so if you hear me refer to BIG over the course of the webinar, it's not an adjective, it's an acronym. So Satya, if you want to move on, great. So just some background on the Behavioral Insights Group. We are based at the Harvard Kennedy School, but we are actually a cross-university entity. So we have currently 37 faculty across 8 Harvard schools and departments. Those are faculty who are engaged in behavioral science research for the public good, largely field research, although a number of our faculty do combine that with lab research. Essentially any school you can think of that might be doing this work. So Harvard Business School, where Leslie is, the Kennedy School, Graduate School of Education, School of Public Health, the Law School, Economics and Sociology departments. Anyone who is doing this kind of work we try to bring into the fold. What I do is threefold. So there's the faculty, we try to create opportunities for them. There's a student group here at Harvard with about 700 members from across the university who are really engaged in trying to learn about behavioral science and bring it to their work post-graduation and while they're here at Harvard. Our goal is to connect faculty to each other and to international entities, and a lot of my time is spent dealing with programming and courses for students. So Satya, if you go to the next slide, I'll sort of break down the three constituents. So as I mentioned, three core constituents: faculty. What I do a lot of my time is try to make connections between faculty and governments and organizations like yourselves to facilitate research and bridge the academia-practitioner divide. Students. So what you may have found occasionally in working with faculty is often the needs of an organization or a government don't necessarily match up with exactly what a faculty member might want to publish or do long term. So in that regard, I try to redirect some of that research onto our students. So as I mentioned, we have a terrific large group of engaged students at HKS and elsewhere. Many of them are looking for opportunities to do work that I'll go into a little more in depth. And then, as I mentioned, talking to folks like you who are from governments and organizations who are looking to apply behavioral science to public policy in a variety of entities. And I'm going to go through a little bit of our faculty research, but at the end of this webinar there will be a link to our website, and you can take a look at a list of all of our faculty and their research interests, and I'm always happy to connect you to anyone you're interested in talking to. So Satya, if you go to the next slide. So a couple of these will be research tidbits from Todd Rogers, who is one of our terrific faculty here at HKS. Some of you may have, in your personal lives, just gotten one of these postcards from a company called O-Power. It's usually tied into your sort of utility company, and it might have said, oh, you're using less energy than your neighbors or more energy than your neighbors. So this is an example I like to use. Social norming is very popular in behavioral science and very effective. So O-Power is an organization that works with utility companies to, as I mentioned, send out those kinds of mailings. And they have dramatic effects in terms of encouraging individuals to use less energy. So Todd Rogers is one of our faculty who has done this research with O-Power. If you go to the next slide, Satya. Another faculty member, Bridget Terry Long, who is the academic dean of the Harvard Graduate School of Education. She's done a really terrific study basically trying to figure out how we can encourage more individuals to fill out the FAFSA and apply for financial aid. So I don't know if any of you have kids in college or yourselves applied to college. The FAFSA is a really terrible financial aid form. It's long, it's cumbersome, it's tied to your tax returns, which are also long and terrible and cumbersome. So Bridget worked with H&R Block to target vulnerable populations that might not know how to use the FAFSA or be interested in filling it out to basically auto-populate tax return information into the FAFSA. It, again, dramatically increased the number of people applying for and receiving financial aid. I think this is a really elegant example of how our faculty are taking existing materials and creating low-cost ways to improve outcomes for people at all levels of society. And then, Satya, if you move to the next slide. So this is particularly relevant, I think, today. Todd started out his research doing voter turnout. So some of you may have seen videos from Barack Obama this election, talking about how he was going to vote early. At the end it would say, be like Barack Obama, make a plan. Joe Biden did one too. Hillary Clinton had a HillaryClinton.com/make a plan. So we found that Todd did some terrific research that basically what we thought had worked with voter turnout doesn't work. So telling people voter turnout is going to be low doesn't work. What does work is encouraging plan making and stressing high turnout. So again, just a good example of how our faculty are really trying to apply research to improve policies that exist, improve forms that exist. One thing that I haven't included in here, but I think is another really great example, Max Bazerman, who is the faculty co-chair of this group, has done terrific research on how essentially if you move the signature from the bottom of a form to the top of a form, so if you've ever filled out an insurance form or your tax return and signed at the bottom, moving that signature line just to the top of the form dramatically reduces the level of cheating on the form. So again, I think in society people tend to view the way things are and think, surely someone exists, created this form for a reason. Why would we change it? And what our faculty do is try to see what exists within, forms, policies, different things in different contexts, and say, what happens if we make a change, and let's test that change to make sure that we're actually improving policy. So again, just stressing research-based policy, data-based policy, seeing what works before we roll it out on an entire population of folks. And Satya, you can go to the next slide. So there are a couple of ways we'd love to engage with all of you, and I know Satya is going to go into the workshop we hope to do in the spring, but one way that you can engage is working with our students. So we have a few levels here, master's students, again, tons of them across Harvard who are very eager to engage with organizations and governments that are interested in this work. These are really bright students who are coming from sometimes professional backgrounds. They have training in behavioral science. Just to emphasize sort of the level of interest we have, we're running a co-curricular not-for-credit class this semester on running randomized control trials, or RCTs. We've had a huge number of students who signed up for that. So that's the kind of thing that we definitely pictured as sort of nitty-gritty, not very engaging, who would want to sign up for it. And students are recognizing that there's just huge demand and increasing demand from many different entities looking to apply behavioral science to policy. So we take it upon ourselves to, through curricular classes, co-curricular classes, just make sure that our students are trained in this work and have the opportunity here to work with folks like you who might have, real-life problems. You can sort of think of this as free, really engaged labor for you to utilize in a variety of ways, including the policy analysis exercise here at HKS, which we facilitate, independent studies. Every school has an independent study program. There are a lot of doctoral students who work with folks like Leslie and all of our faculty who are really eager for client sites and projects. And then, as I mentioned, this co-curricular entity called the Experimental Pitch and Innovation Competition, or EPIC, which is the RCT workshop. And we're starting to collect projects for the spring, so you can always reach out to me. And then working with the Harvard Behavioral Science faculty, at the end of this webinar, again, as I mentioned, a link to our website will be there. You can take a look at our big list of faculty, and if there's someone you're interested in connecting to, I'm here to facilitate that connection. So we have faculty who, as I mentioned, are very eager to find field sites for their research. Just to give you a little bit of background, they are looking for folks who have data that they can provide to you, maybe a problem that you're working on that you really appreciate the academic background on. I set up brainstorming sessions with our faculty, so you don't need to come to me necessarily and say, here's this exact problem, here's this exact faculty member. We can discuss ways that you could get involved. And then one thing I'll plug, you go to the next slide, Satya. So in June, we hosted a conference called Behavioral Exchange 2016, and I bring this up because, again, at the end of this webinar, I provided a link to videos from this conference. So we had about 80 speakers, 16 simultaneous sessions on topics like public health, charitable giving, government transparency, using data in organizations. And this might be a nice primer for some of you who are not as familiar with this material but would like to see some of the brightest faculty and practitioners in this field talking about this work. So I'll provide that link. But again, that might be a nice way for you to take a look. And with that, I know we're going to take questions at the end, but I will turn it over to Leslie John, who is one of the Behavioral Insights Group's faculty affiliates. She is an associate professor of business administration in the Negotiation, Organizations, and Markets Unit, and she teaches negotiations with the MBAs there, as well as several executive education courses, and she will be talking to you about some of her terrific research.
Thanks so much, Abby, and thank you, Satya, for hosting us, and thanks everyone for listening. I'm really happy to be telling you a little bit about just a couple of research projects. The intention behind what I'm going to talk about today is just that it's kind of a teaser, because my goal is exactly as Abby delineated. I am always looking for people who have interesting problems to solve and are open to doing experiments, doing research with me and other faculty here to try to learn new ways of solving problems effectively. So I will give you a quick rundown of, basically I want to just start by kind of explaining my general philosophy when I think about how to, like the approach I take in solving problems that I try to solve, including one of my major areas of focus is health behavior change. So how do you help people make healthier choices, for example? And so a common way of thinking about how to solve these types of problems is by looking through the lens of standard economics, which has a lot of merits. But the thing with standard economics is it doesn't really provide a descriptively accurate portrait of people's behavior. So wait, hang on a bit with the slides, thanks. So what I mean by that is the way economists say we do behave is not actually how we behave. And so what I try to do is I try to, the interventions I apply to help people change their behavior apply psychological insights to how people actually reason to help them make better choices. So instead of trying to make people behave in a way an economist thinks we behave, in other words, try to make people not irrational, try to clean up their decision making and make them rational, the approach I take and many others in my discipline is to work with people, work with our own, decision making biases, and not try to like make us like completely sound, reasoned people all the time. Instead, to work with the way we naturally are and to use that way we naturally are to help people change their behavior. And I think this will become much more concrete as I continue to give you some examples. So as two examples, if you think of what are the tools in the standard economist's arsenal to change behavior? So basically there's two main ways that economists say we can change behavior. This is, of course, a pretty broad oversimplification, but I think a lot of it rings true. One way, common way that economists say we can change behavior is through incentives, basically changing price. The tricky thing is that, and oftentimes that works, but oftentimes that's not feasible, and moreover, oftentimes, or sometimes at least, when incentives can work actually in the exact opposite way than with how they're intended to work. So one example of that is this kind of famous or infamous, if you will, study of a daycare. There was a daycare that had a problem. And the problem was that the parents kept coming in late to pick up their kids. And so the daycare put on their standard economic hat and said, well, how do we make the parents come on time to pick up their kids? Well, obviously, we'll fine them. We'll impose a fine. So now if you pick up your kids late, you have to pay some money, and that's kind of your penalty. So the idea being that if now there's a cost involved, a financial cost in coming late, then now that will cause people's behavior to fall in line and come on time to pick up their kids. Well, what happened was actually the exact opposite. So instead of making parents more likely to come on time, it actually caused them to become even more tardy. And the reason, and I hope some of you are chuckling, at least smiling, is the reason I think demonstrates kind of the contrast between if we see human behavior from like a psychologist's perspective versus an economist's perspective. So from a psychologist's perspective, what's happening here? Well, when there was no fine, if you show up late, you're a jerk, right? Like you show up, it's super embarrassing, you have to apologize, and people don't, I like to think people generally don't like inconveniencing others, and so the desire to avoid that situation of having to apologize and be a jerk causes people to try to be on time at least, even though obviously it's not perfect. But now all of a sudden when you attach a fine to that, it's like a price. And so now psychologically it's not coded as this social relationship where you're inconveniencing the daycare worker that has to stay late for you to pick up your kid. Instead, what you construe it as is you construe it as, this is now inexpensive daycare. It now becomes an exchange relationship, and in such a relationship, it's completely acceptable to become late because you're paying for the service rendered. So this is just a simple example of how, at first blush, if we think of like, yeah, incentives are great, and many times they work well, but if we understand how people actually make decisions, we can understand that sometimes actually they can have unintended consequences, and in this case have the exact opposite result as what had been intended. Okay, now if we go to the next slide, the second common tool in the economist's arsenal is information provision, which in many cases is great, right? It's kind of premised on the idea that if people are acting against their self-interest, it's because they maybe don't know that smoking is bad for them. If we only tell them, then they'll stop smoking. But obviously, this approach has its limitations. In fact, there have been several studies that have looked at the impact of providing information on about caloric content on people's choices of food. So what happened was, in these studies, they looked at, so there have been lots of initiatives for companies to post calorie information on their boards, and like on the menus. And so what some researchers did is they looked at how many calories people ordered before the calories were posted versus after the policy had changed, after the calories had been posted publicly, how many calories, like the average caloric content of what people ordered was. And so on the surface, you think like, oh, well, if people only knew how many calories are in a Big Mac, well, then that will cause their behavior to become more desirable, and it will make them think twice before ordering a Big Mac. But in fact, so some researchers found that this has no effect. Posting calorie labels doesn't change people's behavior at all. Other people have found, in some cases, the opposite can happen, whereby, and this is where this graphic applies that you're now seeing, what sometimes can happen is that it can cause people to choose the most highly caloric, like the densest items. It's as if they're having this kind of this heuristic of maxing out on a metric, right? So if you provide people with a metric of a calorie, it now becomes something that people need to optimize, which actually, if people behave this way, would produce, again, the opposite behavior as what the general spirit of the calorie labeling movement would want. Okay, so I'm simply going to show you a couple of experiments that take this idea of breathing psychological life into the standard economic arsenal of how to change behavior. And I've done quite a few different research projects on this. I've done some work in how to structure incentive systems so that they leverage psychological principles to make them more effective than they would be if you don't understand how people actually make decisions. But I'm not going to tell you about that today. I'm going to just tell you a little bit about just a couple of quick examples of how, instead of just giving people the bare bones information, like telling them how many calories are in something, which is like completely meaningless to people, and as I just mentioned, can actually have the opposite effect of increasing consumption. Is there a way that if we think about how people actually make decisions and interpret information, that we can actually use information in a way that is motivating to people, that helps them change their behavior? So with that in mind, one simple study that we did was we looked at this idea. Some people, basically we looked at how people's purchases of chips in a cafeteria, and we just varied the information we gave them on the chips. So some days the chips had this label, which simply said 160 calories. So this is just the bare bones calorie information. This was our control group. Other days, you can flip to the next slide, we put, again, it contains the same information as in 160 calories, but we breathed psychological life into it, because now I understand what this means, right? If you just say 160 calories in the absence, like I have no clue what 160 calories is. But now if you interpret that for me and say, actually you have to burn it off, 160 calories, what that means is you have to burn it off by biking for 30 minutes. And then we took it even further, and we had another version where, so we pre-tested and we tried to find things that, different exercises that varied in how aversive they were to people, and sit-ups turned out to be one of the most loathed activities. And so what we found then was that people were less likely to choose the chips when we gave them one of these two labels that basically interpreted what calories mean. And this example also illustrates kind of a basic way of working with faculty and researchers in general is, in this case we had a cafeteria and we put up different labels, and we, myself and research assistants, measured with the cooperation of the cafeteria the sales. So it's quite simple, and it can be incredibly simple, but yet the insights that it gives you I think, although I'm biased, can be powerful and hopefully broadly applicable. Okay, then the next example is another example of how to, again, on this theme of breathing psychological life into information. So we just completed a study in a different cafeteria where we, again, our goal was to try to get people to make healthier choices. And what we did was we varied the way we told them how many calories are in a bottle of soda. So in this case, we were trying to get people to switch from choosing like Coca-Cola to, say, water. So our outcome measure was the sales data. We wanted to see how did Coke and sugary beverages sell as a function of the different calorie information we gave people. So in our kind of control group, and this went week by week, so some weeks, our control weeks, we simply posted the number of calories, which is what you're seeing right now. This is the control condition, or the comparison group. It tells you just how many calories are in a soda. Okay, well then we thought, how can we improve this? Well, one improvement might be the following. You can click on the next slide, where we now have just a warning. So it's like a stronger conveyance of information, and maybe that'll be more effective. But what we actually thought was we thought that we can make this much better by breathing life into it, by helping interpret what these things mean to people, and having graphic warning labels, which is what you're seeing here. So again, it's kind of, it's like the same idea across all, in that we're giving people information to try to help them, you know, step away from the Coca-Cola, but the way we give them information is really varying as a function of our understanding of the psychology of how people reason. And so this particular version here we thought would be most effective because it really digests for people, for, excuse the pun, what it actually means to consume these sugary drinks. And sure enough, what we found was that the only thing that worked was this label. That was the only thing that curbed people's purchases of sugary drinks. And now the really nice thing about it was that it didn't decrease sales. So the cafeteria was happy because it's not that people just chose forwent buying a Coke. They actually substituted, they changed their decision and they bought the water, or they bought even the Diet Coke, which is probably better than a Coke, at least in terms of sugar. So it was a really nice result on both those fronts. And this is also an example of, Abby was mentioning that there are, of course, lots of different ways that you can partner with us, and one is potentially with a program called EPIC that she mentioned, which is like a contest for students here where they pitch different ideas, a field experiments, which we then go and test. And this study here with the graphic warning label, this is where the students came to me with this idea, and then I helped them design it and implement it, and we're now writing it out. So that's just an example of one of the many ways you can work with us. So those are just a couple of examples out of many, and the people that I work with here, it's an embarrassment of riches. There's like no shortage of ideas. And so just to summarize some broad thoughts of when kind of this approach works best. It works really well when people have things that they really want to change, but they've been having difficulty accomplishing. So health is a big one, right? People often have goals to lose weight, and they often have difficulty accomplishing them. There's lots of other areas, like savings is another area, domain that's really ripe for that. Voting as another area. Public transportation, charitable giving, all kinds of behaviors that are in the interest of the individual and society that are admirable, but that for various reasons people have difficulty accomplishing. So with that, I'll stop there. I hope that this is kind of just giving you a teaser and piqued your interest to do research with us.
Great. Thank you very much, Leslie. I appreciate it. And let me put up, so here's Leslie's contact information, and then here are the links that Abby mentioned, and also contact information for our point person here at the Mayor's Innovation Project on this work, and that's James Irwin, who is not with us today, but will be the point person going forward. Let me pause here and see if we have any questions for either Abby or Leslie on the nature of the work, on the opportunities at Harvard, or anything that they have talked about. And if you have a question, you can either type it into the question box, and I'll read it out and get it answered, or you can raise your hand virtually on the webinar, and I can unmute you, and you can ask the question yourself. So I'll give a chance for any of the folks on the phone to ask any questions. And while we're waiting to see if there are any, Abby, can you maybe just talk a little bit? You did outline a number of sort of opportunities to either work with students at different levels or to work with faculty. And are there examples of other local governments that have done that in the past?
Yeah, so there are a few governments that have worked with us, and some of the descriptions. So the Behavioral Insights team in the United Kingdom is sort of the premier government organization. They're now semi-privatized and no longer at 10 Downing Street, but we do have a partnership with them through the Sloan Foundation. So a lot of our faculty do work with them. We have a student this year who is doing a policy analysis exercise with them as well. Max Bazerman actually teaches a course where we take HKS, School of Public Health, and HBS students to the UK to do work with government entities in the UK, so Public Health England, Her Majesty's Revenue and Customs, which is their tax agency, the Department for Transport, so a number of those folks. We're also, some of our faculty do work with the Social and Behavioral Sciences team in the White House. A lot of our faculty do work with cities, actually. So Mike Luca is one of our faculty members. Some of you may know his work. He's done work with Yelp in San Francisco and in Boston, figuring out how to use essentially online platforms to improve public health outcomes. So if you've ever gone onto Yelp and seen a health grade the way you could see it in a restaurant window, he's sort of the brains behind that. We've done some work with the Israeli government, the Dutch government, through a few different government agencies there, including the Ministry for Infrastructure and Environment. So a number of folks do reach out to us, and again, a lot of our faculty have their own connections, but I'm always happy to set you up with anyone here. I don't mention all of the faculty we work with, but some of our faculty, and they always bring up Jim Greiner, who's someone at the law school who I think is just doing some really innovative work on how you bring RCTs to law. So some of you may work with lawyers and know that they, it's not the way it is in medicine where RCTs are sort of the gold standard in law. Jim is doing a lot of work on how you improve outcomes for legal aid clinics, basically places where there are not a lot of resources, and he thinks about how we can reallocate resources accordingly. So yeah, I'm happy to chat more about that. Looks like there's a question or two.
Yeah, thanks. We have a question from Joe Sulak. Joe, go ahead.
Hi, I have a question. I'm represent a municipality, Grand Rapids, Michigan, and we're looking to possibly use this type of research in encouraging people to plant trees on private property to meet our canopy goal. But the question I had is there was a mention about some information that might be needed regarding to get some students involved or interested. What type of analytics are you actually looking for to, as a baseline, to get some of these things started?
So, Joe, I don't think we need tons of specifics just yet, and this is a very unscientific way of approaching it, but I always just encourage someone to, if you wanted to reach out to me and sort of we could talk through what the project looked like. The way I then approach it is I will either have students in mind who I know are interested in this kind of work, or we have a newsletter that goes out every week to our student group, and then weekly sessions where we get some of our more engaged students as well. So I'm happy to advertise accordingly. Students don't necessarily need to know immediately. Here is the exact data that they'd have access to. Here's exactly the problem that you want them to solve. But I think just an overarching idea is what's most useful to get started for sure.
And that best contact information is this one that's on the screen?
Yeah, so I'm Abigail, yeah.
Okay, and I'll just follow up with the...
Yeah, exactly.
Okay,
and
sounds
actually, Joe, thanks for asking that because it's the perfect segue to the next slide. And let me say a little bit, and then we will certainly continue to take questions if folks have them. But we at the Mayor's Innovation Project are hoping to get a group of cities, a cohort of cities together that want to use these techniques in various ways in your cities, whether that's to get people to plant more trees or to improve your human or community service delivery or to improve your rate of tax payment or, any number of different things where, these questions that could be asked and answered using behavioral science. And so you'll see now on your screen there's a link to a Google form where we ask you just basically what city are you from, a little contact information so we can follow up with you, and then if there are research questions or problems that you'd like help solving, and at a very high level what data sets might be associated with these issues and problems. So in your case for Grand Rapids that might be, do you have an inventory or a way of measuring your canopy cover that you've done in the past, and do you know what it is now and where you're trying to get to, and or for it might be some other set of city data for a different type of question. And so based on that information, what we'd like to do is help cities connect with the right place at Harvard, and working with Abby to do so, to get you hopefully help on your problems. And then, as Abby mentioned, we're looking at bringing the cohort together in person at Harvard to get more information and knowledge about how to use these techniques to work on issues that cities have questions about or want to be applying these techniques to. Abby, is there anything else that you want to add to that description?
Sure. One thing I'll add is I know sending you to a website with 37 faculty listed can be overwhelming. So again, if you aren't sure if this is right for one of our faculty members or our students, I'm always happy to chat with anyone who wants to sort of parse out what the options are. And again, I can sort of help you think through for our faculty, what are they going to be most interested in, for our students, what will they be interested in, even little things like which of our faculty are on sabbatical or who just had a baby and might not be as available right now. So again, just definitely don't hesitate to reach out directly to me, and we can sort of work through whatever you're interested in thinking about.
Great, and I do think there is a lot of possibility here for cities. It just takes a little creative thinking to understand the kind of problem that you can test here. And hopefully folks will have a better sense of that based on the webinar today and the links that Abby shared. Are there any other questions from folks on the line? I know there's a lot of cities represented here on the call today. Do other folks have things that they are potentially interested in testing or working on that they want to run by Abby and Leslie? Or any other questions? Go ahead and hit your hand raise button if you have one, and I can unmute you. Or again, you can use the question box. And Abby or Leslie, is there anything else that oh, we do have one question, and then I'll go ahead and ask my other question. Katie Johnston?
Hi, this is Katie Johnston with the City of Tacoma, Washington. So one of our areas that I think might be of interest, and so I'm curious how you kind of feel about this area, is we tend to use fines and monetary penalties against derelict buildings, but it seems to elicit very little in terms of action. So we've been trying to think about different ways of eliciting action from those property owners. Is that an area of interest in research?
Yeah, so Katie, I can think of a couple of faculty that might be interested in that. And here at HKS, we have a number of students who are definitely interested in sort of civic engagement and cities specifically. So yeah, that's definitely up your alley. I think it's hard sometimes to, especially if you're not as familiar with behavioral science, to think, is there a behavioral science approach to this problem? But again, not to say come with all of your problems and we can solve all of them, but I think there can be some creativity, and you never know what our faculty might be interested in working on, for sure.
And Abby is amazing at marrying people. It's really true. If you come, and that is a question that the question you articulated is exactly right for behavioral scientist intervention. But yeah, bring your questions, and Abby is incredible at finding marriages. Among other things.
Great. Thanks, Katie, for your question and for being on today. Other questions? And what I was going to ask Abby and Leslie was, are there, and maybe you've already answered this, but are there particular types of problems or questions that lend themselves more easily to this approach? And then the other thing that you might comment on, you did use the acronym RCT, which I know means Randomized Controlled Trial, but most people might not know what that means.
Sure.
So maybe just a little more on that.
Leslie, do you want to describe an RCT, or do you want? I'm happy to. You run them.
Oh, well, sure. Yeah, an RCT this is a top list for me. It's an experiment, which is another explaining jargon, which is probably not helpful. So basically, what it means is when you have an idea of how to change behavior, you don't want to just do the thing that you think will work. You need to compare it to something. So basically, an RCT, an experiment, essentially means what you want to do. You want to test the thing you think will work and hope will work. You want to do that sometimes, and then you want a comparison group where you don't intervene. You don't do the thing that you think will work. And that can take a variety of different approaches. One is to simply let people be the way they are before you intervene. The key thing is with an RCT is you need to have a comparison, so it enables you to truly assess whether your intervention actually had the effect that you think it had. Because if you don't have a comparison group, you really can't articulate whether the intervention had the effect you thought. In other words, having a comparison group gives you the counterfactual. It tells you what would have happened if you hadn't done the intervention.
So a good example of this is we had some students a few years ago propose an RCT, a randomized controlled trial, with an office within the Dutch government, and had to do with littering. And the Dutch government office was so thrilled. They said, oh, this is such a great idea. We think it's going to work, so we're just going to implement it on everyone. And so Max Bazerman actually in that scenario approached which is terrific that they thought the students had such a great idea, but again, we want to make sure that the great idea works. We don't want to roll things out on populations for good ideas that actually don't work, because often what you predict is not necessarily the case. So Max pointed out, and this is maybe useful for all of you, it's still a randomized controlled trial if you're implementing on 90% of the population, but not the other 10%. And as Leslie mentioned, that can be anything from maybe you have several arms of a trial, so you want to try 4 different messages in an email to a population, and then the final message is just what's been going out previously. Or in the case of moving the signature from the bottom of the form to the top, you would compare outcomes for people who are filling out forms as they are and filling out forms with the signature at the top and seeing if you've improved outcomes there. And again, it's just a research-driven way to say, now we know that this works, we know how much it works before you're actually investing a lot of time and money in something that might not be as effective.
And is there a sort of minimum sample size that you need for that?
So it depends on the effect size you're looking for, and this is getting fairly technical, I think. I know I referenced power calculations, which is something we teach students in this experimental pitch competition, but that essentially teaches the students, if you want a certain kind of effect size, here's the sample size you need. And often with our students, what we have them do as they're sort of learning RCTs is run something very small. So maybe they're testing out, getting people to recycle more in an area of the Harvard campus, and so they're not going to have 10,000 people there. It's not an email list with that many folks, but they can see if putting something down improves outcomes a little bit so that they can sort of do little practice runs before taking it bigger.
So if a city had something where they thought they have something that's interesting, but they are not sure exactly how many people they would be dealing with, it's still worth them maybe proposing that or coming to talk to us about it.
Yeah, absolutely.
Even if they're not sure how many people they could impact.
Yeah, and that's something where if I identified a faculty member or two who would be interested in that, I could connect you to them, and then the faculty run these RCTs all the time. So if you came to Leslie and you said, here's our data set, here's our problem, she could easily tell you what she would need and what would work for you and how to maximize, I think, for making this as an effective an enterprise as possible.
Great. And just from what I've picked up, sort of in layperson reading and listening about this, it seems to me like there's a few areas that cities might be able to do some really interesting randomized controlled trials in, certainly in anything that involves public communication where you can be, kind of controlling what message goes out, a different message at different times or a different message to different groups of people is one place that you could use something like this. And then another is where you know that you're not able to serve everybody. You can get data on everybody, that you could use an experimental setup to test the impact of one or more interventions.
Yeah, exactly. And we have faculty working on things like increasing uptake of 311 in cities. We have faculty thinking about how you can improve. This is Mike Norton, who's over at HBS, who some of you might have heard from, has done research on basically improving happiness with government. So how you get people to be happier paying taxes or with public services. Again, we have thinking about legal aid clinics, thinking about public health, so education. Todd Rogers runs now. He's sort of turned from voting and energy to student attendance, which can be a big money saver and obviously improve outcomes for children in school districts, and he's working with a number of school districts around the country. So again, there's a lot of ways that we can apply this, and sometimes honestly, the lessons from one domain, I think, can be really interesting even if it's not specifically what you're working in. So what has worked in education or public health might work for you in terms of government transparency or getting people more engaged with your city as well.
Great. So we do have time for a question or two more if anyone wants to raise their hand or enter a question into the question box. And otherwise, I'll just encourage you that even if you are not sure, if you think you have something that you might want to work with the folks at Harvard on, whether that's students of, undergraduate on up to PhD or faculty, to go ahead and fill out the form that's on your screen here at the behavior cohort URL. And enter your ideas, and we'll obviously be sharing them with Abby and be in touch with you about the possibilities. But I think my sense, and Abby, you can confirm this, is that it would be better to throw the ideas out there, even if they might not ultimately end up working. But we'd rather have more ideas than fewer, and let's work through whether the ideas or questions that you have would have the right data or the right structure to lend themselves to this work.
Yeah, exactly. Nothing is sort of too basic or again, when in doubt, if this is interesting to you, definitely email me. I spent a lot of time thinking about how we can make this work, and even if we can't make it work in the next couple of months, I think there's always a possibility for making it work later on.
Great. So not seeing any more questions. If you do have them going forward, feel free to contact either, and I'll bring the contact information up again here, to contact either Abby or James or both with your questions or ideas. Certainly encourage you to, again, fill out the form. if you're interested. And let me thank you very much, Abby and Leslie, for taking the time today to give us some examples and explain a little more of your work to us. I feel like this is very interesting stuff, and there's a lot of potential for cities here. And we're very excited about the possibility of bringing a group of cities together to work with you.
Sounds great. Thanks so much.
Thanks very much, everyone. I'm going to take the recording and the webinar offline, but don't hesitate to follow up with us in the near future. And have a great day.